For this group assignment, you will be divided into 4 groups, and as a member of the group, you will participate in submitting the assignment, much like you have in other groups in your PTA courses. I'm thinking particularly of 204 lab and 205 lab, and more specifically 104 lab, where you submitted group assignments, and one of you acted as moderator. So the rubric is found in Moodle, where the other rubrics are found. You have different assignments that correspond with different groups, so they're not all the same. The first group, you're going to go ahead and create a schedule for yourself, and the instructions are found in here. They are, I think, pretty clear. The challenge is to go ahead and create a schedule with these different payer sources, knowing that different buildings will have different workplace practices related to treating different populations based on their commercial insurance or their government insurance. So you have a resource that's available here that helps you with the assignment, that's fundamental to the assignment, that tells you how much different codes are reimbursed, and then you are to develop your day, a 7-hour day, with seeing these following patients and essentially creating your own schedule, kind of planning the next day, so to speak, of who you're seeing and when. This is an outpatient setting. So you have 9 patients, which is not unusual in a 7-hour day. I think I shared with some of you that one of the clinics I worked at, you saw patients for 30 minutes, and so after a 10-hour day, it was pretty common to see upwards to 14 patients, which is a lot, and in some cases it's closer to 15. So since you worked with these numbers before, some of the reimbursement amounts should not be too surprising to you, especially those of you who have worked as aides. You can see there is a bit of difference based on the payer source. So that's group 1, and you're to submit these assignments in Moodle. So you submit them in the week that we're talking about, which is week 10. And you're going to, here's where you submit your assignment, 1 submission per group, and then you're going to post your project to the class so that everyone in the class can see your assignment. So it's going to be a learning opportunity for everybody. And I think it's good practice to go through the different scenarios yourself and decide how you would handle them. In particular, I think it's good to go through creating a schedule if you're not part of that group, because that is what you will often do with the help of a scheduler. The scheduler will often create a schedule, then you go through it and you make changes based on if there's an error, which can happen, right? Creating a schedule is not easy. There are things that can get overlooked. The other 3 cases involve cases of fraud. So this is a course on ethics, so it's for you to use your theories of, going through, for example, we worked in week 2 and 3 particularly on how to resolve an ethical dilemma, and I provided a few different models, the RIPS model as well as Gabbard having a model as well. So use those models to go through these different cases to come up with your answers. And that's pretty much it. So I'm looking forward to seeing your assignments once they're completed. Again, 1 submission per student, and you're going to post your completed assignment with your corresponding group members, and you know, it's pretty clear in the rubric that how you're going to earn your 10 points, and it's a low stakes assignment, but how important it is that everybody be involved in the process of creating your assignment. Have questions? I would like one person from the group to be the spokesperson to forward those questions to me, so I'm not getting 3 questions from different groups or 2 questions from 2 different people. I want like a captain, and I'm not going to designate who the captain is. You have to decide among your group who's the captain, and your captain will be the one that asks questions to me, similar to what work you were doing in your group project in 133 and 132, and also the facilitator role you had in 104 lecture.